Hey, good people, here again for part two of patient safety and a few more tips on how you can ensure your patient's safety, whether you are the patient or you're a caregiver of the patient. Because the truth is, even if you're not a patient, you at one point or another in your life have had a patient who needs medical care, and it could be your relative, your friend, or yourself. So, a couple of other things to think about. Um, when you receive medication for your treatment, follow the care instructions you're given. A lot of times you get medicine and you will given instructions about how to use it, some of the lifestyle changes and recommendations like diet and exercise that you need to institute, um, changes in sleep pattern, changes in how habits that you may be having, like smoking or drinking alcohol. Please follow those instructions because they are part of the interventions that will ensure that your treatment plan and your management is successful. The other thing, number two, is um, uh, manage your communication well. Keep an open line of communication, all right? Um, with your doctor, with your healthcare provider, be it the nurse, be it the clinician, be it the physiotherapist, your pharmacist. Keep communication lines open. If you have something you need to clarify, clarify. I say clarify, clarify, clarify. Even if it's 100 times, just make sure you're clear about your treatment plan and you're checking and double checking everything with your healthcare providers. Number three, I would say, is choose accredited and verified healthcare facilities and healthcare providers. There's a lot of information online about healthcare providers, hospitals, clinics, nursing homes. Check them out and find out if they're accredited, and you will be able to receive better care from accredited healthcare providers and healthcare facilities because they have higher standards that they have to adhere to get that accreditation. And some of the accreditation bodies around are known. Some that I could mention is the Joint Commission um, for Accreditation. And then fourth, I would say, is prevent infections, and we call it IPC, Infection Prevention and Control. It's not just a forte of the hospital or the healthcare provider. You also, as a patient, need to be very careful about how you're keeping yourself clean, especially if you're admitted in hospital. But even at home, are you washing your hands regularly before you eat, after you use the washroom, and even after working? Regular hand hygiene has been shown through research to reduce infections by a significant amount. And we saw this during COVID. During COVID, the numbers of diarrheal cases, of upper respiratory tract infection cases plummeted. They literally just went down to almost zero. Why? Because we were all washing our hands, we were all sanitizing, we were all, ensuring that we were keeping clean.